welcome to another episode of Wellness Wednesday with Dr. Wells. I hope you all are doing well. It's another Wellness Wednesday. Welcome. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. I am a family nurse practitioner. I hold a doctorate degree in nursing practice, and I'm the owner of Wells Legacy Health and Wellness. Thank you for joining me for another Wellness Wednesday. This month, we are focusing on a couple different health topics. In the month of April, there are several things that are highlighted or several conditions that are highlighted that I want to focus on. Last week, we talked about alcohol and its effects on the body and how much we should drink or should not drink, and all the side effects and things that can show up in our bodies related to alcohol use and abuse. Today, we're going to talk about minority health. Minority health is another topic that is amplified, that is raised, for awareness, that's addressed in the month of April. Not that it's not important all other months. It is. Every single day, minority health of everyone, but minority health is important. And so I want to focus on that tonight. We have a couple of different things that we're going to discuss. We have some statistics. As you guys know, I love my numbers. We have some tips and things that you can do as a minority and, to make sure that you are protected when it comes to your health. Last Saturday, I had an opportunity to be interviewed by an amazing group or two women that I know and hold close and dear to my heart. They're part of an organization, Iota Phi Lambda sorority, and they wanted to come and highlight my business as a part of their small business initiative. And so I was grateful for that opportunity. During that conversation, we touched on a few things that I'll kind of bring to the forefront or highlight during tonight's session. As a minority and having some health challenges throughout my life, I can speak to the fear that I'll be talking about tonight. I can speak to the distrust that some minorities feel when it comes to the healthcare community, which then leads to lack of care or delay in seeking care or not believing what healthcare providers are saying or the information that they're providing to the individual patient. And so tonight I want to talk about that. April is Minority Health Month, along with several other conditions. And again, it's a time to amplify our as healthcare providers, as individuals, as patients, as a community. It's time to raise awareness. It's time to address the uniqueness when it comes to the health challenges that impact our minority communities. And so tonight we're going to talk a little bit more about some of the things and some of the health conditions that affect minorities more than other groups. And we've talked about this, several of these, throughout Wellness Wednesdays over the past year or so. And so tonight we're going to focus in on just a few more disease processes that impact minorities over other individuals at a higher or disproportionate rate, right? And so diabetes is number one. We talked about diabetes last year. We had my friend and colleague Camille here, and she helped us break down diabetes. We went into a detailed discussion on diabetes and what that means, what it looks like, what we can do to treat it, how you can prevent it if you have diabetes, what you can do as a patient. And so when we're looking at minorities, diabetes impacts African Americans, Hispanic, Latinos, and Native Americans at a higher rate, much higher rate than our Caucasian and Asian counterparts. Heart disease is the leading cause of death among African Americans, Hispanics, and Native Americans. And when we think about mental health, the stigma and access barriers contribute to lower treatment rates despite comparable and higher prevalence, meaning the percentages and statistics show that minorities as well as non-minorities, those who are not minorities, have around about the same number of or percentages of mental health struggles, right? However, there's a stigma in the minority communities and within the minority populations, and there's access to care and there's barriers that are in place that impact minorities that aren't the same for those who are not within this subgroup of people. And it's important to understand the implications of some of these things. Some statistics, and then we'll go into a little bit more about some of the other conditions. African Americans are 60% more likely to have diabetes than non-Hispanic whites. Hispanic adults have 50% higher mortality rates from diabetes and liver disease compared to non-Hispanic whites. Native Americans are 50% more likely to be diagnosed with diabetes than those who are non-Hispanic white. Additionally, when we speak of cancer and we talk about pregnancy, minorities, again, face different health conditions at a higher rate, higher percentage than those who are not considered to be minorities. And so when we talk about pregnancy, and there's a individual on Instagram, Nurse Tisha. She's an RN. She talks about a lot of great health topics. So if you have not followed her, I would definitely recommend you go and you follow her as well. She's a great source for the community, and she does a lot within the community. This month, she was speaking on preeclampsia. And for those who don't know what preeclampsia is, it's a condition that impacts women in pregnancy, and it usually shows up around the 20th week of pregnancy. And there are some signs and symptoms. This can be deadly. And many times, because of lack of care, because of fear, because of not knowing what the signs and symptoms are of preeclampsia, women die from it. And our minority women are dying at a higher rate from birth-related, childbirth-related, delivery complications than other individuals. So there's a higher rate of maternal mortality among African Americans and Native American women. There's disparities in access, or there's a gap when it comes to access to prenatal care and maternal health services. There's increased risk of pregnancy complications such as preterm birth, low birth weight among minority women, as well as preeclampsia and things of that nature. And so it's important that we highlight these things. That way we can pay more attention to it. We can be aware, we can be educated and know what to do as a community. Cancer affects minority populations at a higher incidence in regards to mortality and then survivorship rates. So I know we spoke several times, or I know we spoke previously about cancer in the breast cancer in African American and minority populations. Most of the time, when cancer is found in minorities, it's found at a later stage, meaning there was a delay in seeking care for whatever reason. And when these individuals came in, their cancer was either more aggressive and or at a later stage. And so when it comes to some statistics about breast cancer, African American women have a higher rate of breast cancer compared to women of other racial or ethnic groups. There are also, as I mentioned, most likely to be diagnosed at a later stage and have a higher mortality rate. So they're diagnosed later and their chances of dying from that cancer is higher. The American Cancer Society says that they're about 40% more likely to die, African American women, than white women, despite having lower incident rate. So despite the lower numbers of being diagnosed with breast cancer, they die at a higher rate. When it comes to prostate cancer, some statistics about that says that African American men have the highest rate of prostate cancer in the United States. And they are about 1.7 times more likely to be diagnosed with prostate cancer and have a 2.2 times higher chance of dying compared to white men. And they tend to be diagnosed at a younger age. And when they are diagnosed, it's more aggressive form of the disease and cancer when it relates to the prostate. These numbers are startling, they're shocking, yet year over year, we continue to see the numbers remaining steady or increasing. We have not yet seen a decrease in some of these numbers. When we look at education that's being provided in the community, then we begin to see some impact of the decrease because people are more aware, they're more vigilant, they're more likely to go and get their health screenings, which is one of the reasons why I do this each and every day. I do the Wellness Wednesdays. I went to school to become a nurse because I wanted to make a difference. I wanted to make sure that the people that I love, the people that I care about, receive the best care. And because this is just who I am, but to be able to make an impact in the life of someone by sharing a statistic, by sharing some of the recommended screenings that we should be getting, if I can reach one person, then I've made the difference that needed to be made. Colorectal cancer. African Americans have the highest rate of colorectal cancer among all racial and ethnic groups in the United States alone. They're about 20% more likely to be diagnosed with colorectal cancer and about 40% more likely to die from it compared to white individuals. And it's partially due to a lack of screening rates and access to quality care. I can not tell you how many times I've had conversations with individuals who fall in the minority category, who are resistant to getting a colonoscopy, who are resistant to completing the stool kits, whether it's an IFOBT kit or the Cologuard, what have you. They're so resistant to taking the kit and completing the kit and or going to get a colonoscopy based on the recommendation related to age, gender, and family history. And one of the things that I get, and I understand, I don't want to play in my poop. It's a quick, simple swipe if you're doing one of the kits, a simple swipe. And honestly, we should be looking at our poop every time we have a bowel movement, right? So I don't know, maybe that's just me, but the things that we eliminate from our bodies tell us a lot about ourselves. And you need to look. You need to make sure everything looks okay and that there's nothing abnormal. There's no blood, things of that nature. So I'll get off my soapbox there. But it's so important that we take to heart our health and the things that we can do to help ourselves when it comes to our health and the screenings and these statistics and knowing our family history and getting the screenings that we need. Lung cancer. Overall, lung cancer rates have been declining. We're seeing that in the African American community. African American men continue to have the highest incidence and mortality rates of lung cancer compared to men of other ethnic and racial groups. They're about 15% more likely to develop lung cancer and 30% more likely to die when compared to white men. We talked about our liver last week, and we talked about our liver in the beginning of the month when we had Dr. Ama Siwabantu as a part of our Wellness Wednesday. she talked about transplant and things of that nature, but we talked about the liver. We talked about the liver last week and how it impacts, how alcohol can impact our liver. And when we look at liver cancer, Hispanics and Asian Pacific Islander populations have a higher rate of liver cancer compared to non-Hispanic whites. And so the CDC says that the liver cancer rates are highest among Asian Americans and Pacific Islander men, followed by Hispanic men. When we look at cervical cancer, Hispanic women have higher rates of cervical cancer when compared to those who are non-Hispanic white. They're 1.5 times more likely to be diagnosed with cervical cancer and have a higher mortality rate. And the reason is because of limited access to preventative screening or not knowing when to go and get the screening and things of that nature. So it is so important that we get these screenings, that we follow up when we go to a healthcare provider and they mention that something is going on that we need to follow up on and get additional screenings. And I know I just threw out a lot. The key pointers is I want you to know if you're a minority, you're at a higher risk for developing certain conditions, diabetes, heart disease, cancers, regardless of the type, mental health disorders. We're at a higher risk. We carry a higher risk for certain conditions. And so we have to be diligent to make sure we're doing what we can do for ourselves as it relates to our health. This past Saturday, I was having a conversation with Dion Dumas, and she got married, and I believe it's Blackman. Don't get me if I got your name wrong. I'm so sorry. And Sandra, and we were talking about fear. Dion and I had the conversation initially, and she was asking me why I started the business, how I started it, how did it come to be? And I spoke about fear, how fear held me captive for so many years, and how I would get so close or get so far, and then I back up because of fear. And when we think about fear in the healthcare system as it relates to seeking healthcare by minority populations, there are historical injustices and ongoing disparities that increase fear and mistrust in minority communities, which then hinders healthcare access. They don't feel we don't trust when it comes to healthcare providers. And I could sit and list the many different instances that I know of, but I won't spend this time doing that. But we can think of many people who have lost their lives at the hand of healthcare because of lack of understanding, lack of urgency, a myriad of different things. I'm not going to harp on those things because my hope is that one thing that I say tonight will change someone's life. Someone will go and get screened. Someone tell a family member about a sign and symptom that they're having. Someone will tell a family member, hey, I think you meet the criteria for going to get screened or going to get checked for this. That's my hope. So fear, I talked to Dion last week about fear, and we discussed another situation where there's a young lady who we think is fearful of going to get the care that she definitely needs. And when we look at statistics, we know that we're at a higher rate for developing certain conditions. And when we add fear on top of that, I have had patients to say to me, well, I'd just rather not know. If there's something wrong with me, I'd rather not know. I've had women who tell me their response to when have you had your mammogram or when it's time for your mammogram. And they'll say, if I have breast cancer, I don't want to know. Don't tell me. But if we found it early enough by screening, then there's something that can be done that could potentially save your life and change the trajectory of your family and your lineage. With Wells Legacy Health and Wellness, I speak so much about leaving a legacy of good health. And this is included. Like, this is a major part of that. If we know that our family history has breast cancer, colon cancer, mental health disorders, and we're open and communicative and talking about it within our families, then we know that there's something that we can do about it. That the next generation knows that. My daughter knows that she's at risk for certain things, so she needs to make sure she's been diligent about her screenings. My son knows that he's at a higher risk for developing certain things because, one, his race and his ethnicity, and because we have that family history of a certain thing, then they can go and get the care that they need. So delayed or avoided medical care leads to worse health outcomes, lower rates of preventative care and screenings, and then heightened stress due to healthcare related anxieties. And that's a whole nother Wellness Wednesday in and of itself. So one thing that we want to do, one, is acknowledge and validate concerns and fears of our minority communities. One, to build trust within the healthcare system. And this is something that we as healthcare providers can do. We can advocate for culturally competent care to address the unique needs and perspective of diverse patient populations. So what does that mean, culturally competent care? That I am invested in knowing my patient's culture and what they prefer and what they don't prefer, what their preferences are. Are they willing to take a certain treatment? If so, why not? What are the alternatives? I want to make sure that I'm empowering my patients, one, to advocate for themselves, to seek out providers who respect their cultural backgrounds, who understands them, who takes time to educate them and listen. I can talk to a patient all day long, but it does me no good as their healthcare provider if I don't take time to listen to them. We want to promote open, honest dialogue about health issues within minority communities. One, to reduce the stigma and to increase awareness. The more we talk about it, the more people say, oh, I'm not the only one who's dealing with this. Or, oh, wow, that's common in our community. Yeah, it is. So we have to talk about it. We have to talk about it. There's so many people who are private. They don't want anyone to know when they're dealing with certain conditions or certain things going on. And that's fine. That's your right to do so. But from a healthcare standpoint, I can understand how that can impact one's family if they don't know. When we talk about women and pregnancy, we hear on the news and social media about all of the negative things that happen, all of the bad things that have happened, all of the people who've had issues. And I will tell you, a person will tell you a bad review about something before they will share a positive review. And when you post it on social media, you have conversations about it, you're going to get more feedback from the negative most of the time than you do positive. And there's a lot of positive. There's a lot of great healthcare providers who will take time, who will walk you through from A to Z what's going on, the symptoms that you're having, things of that nature. And so things have changed. Patients are becoming more aware and vocal and verbal about their health, which is amazing. I love that. When I have a patient that comes in and they have the questions for me, they've done their research. Yeah, I say you can use Google a little bit, but don't rely always on Google, right? Because Google will have you scared and diagnosing yourself with cancer and diabetes and all kind of stuff, and preeclampsia, and you're male, and what have you. And so be mindful of that. Yes, we want you to be educated and to be able to advocate for yourself, but make sure you're bringing that information to a competent and knowledgeable healthcare provider so they can help you decipher between the good and the bad of it all. So as a healthcare provider, I play an important role. And I just kind of talked a little bit about some of the things that I can do as a healthcare provider and things that we can do as healthcare providers. We want to, one, make sure that we're building a trusting relationship. Trust is essential, and establishing that trust early on as a healthcare provider is so important. We need to, as I mentioned, take time to listen to your concerns, validate your experiences, what you're dealing with, and then making sure that the patient is involved in that healthcare and decision making. And so, decision making. It bothers me when a healthcare provider is making decisions and the patient is not involved or fully invested in that, right? We're a team. You can't play a game of basketball with just one person. You have to have a team. And so I had a story of a patient that I saw who came to us pretty late, had a horrible diagnosis, and ended up on hospice. And they said they felt so alone and they did not have trust in their healthcare provider. So they would not go and see them. And when they did, they didn't feel heard. They felt that their concerns were dismissed. And this person ended up on hospice and passing away because of that. Shame on us as healthcare providers. We have to make sure, one, that we're educating our patients, that we're empowering our patients, that we're doing everything that we can do to help them. And when we speak of minorities, there's different languages and language barriers that we face as healthcare providers and patients. And so making sure that as a healthcare provider that I'm addressing those language and literacy barriers. I can't give a patient who can't read a pamphlet of information to go over. I need to be able to take time to provide them material in which they understand and that is appropriate for their literacy level, and take the time to go through it with them. And then offering patient-centered care, tailoring my treatment as a healthcare provider to the specific needs of my patients. There's no cookie cutter method, right? Yes, when I went to school, we had this patient has this diagnosis. This is how you diagnose it. These are the signs and symptoms. These are the treatment recommendations, A, B, C, and D, right? But every patient is different. And so as a healthcare provider, we should consider factors such as socioeconomic status, access to resources, and then social support networks. I can't prescribe a patient a medication that costs $300. They don't have insurance and they're a single parent taking care of children. I have to be knowledgeable of those things and making sure that I'm providing the best care for my patients all around. And then one, advocate within the community and addressing the systemic barriers in healthcare. As a patient, what are some of the things that you can do to ensure that you're engaged, that you are able to overcome fear when it comes to seeking healthcare? One of the things is, one, educate yourself. Knowledge is so powerful. And taking the initiative to learn about your health condition, treatment options, importance of preventative care, knowing when you should have certain screenings, having reliable resources to include, one, healthcare providers, reputable websites. TikTok is not it. TikTok's amazing, right? But there's a lot of misinformation on the internet, and people have you diagnosed with all kinds of stuff and needing chemotherapy and all the things, and you got a simple sinus infection. So I say that lightly, but I hear it all the time and I see it often. Seek support. Don't hesitate to reach out to your family, friends, community, organization for support. Talking to people and sharing your concerns, especially those who have similar experiences. I talked about earlier in the month with Dr. Ama Siwabantu about how I was able to connect two patients who were undergoing dialysis. And it made the journey for both of them better because they had someone who understood what they were going through. They understood the ups and downs and the challenges that they would face. And one, finding a trusted healthcare provider. If you don't have a primary care provider, go get you one. You need a healthcare provider, someone that you can build a relationship with, someone that understands your cultural background and your values, and that your input is essential and important. Take time to research and find providers who, one, make you feel comfortable and listen to. There's a network of providers out there and this is one thing that social media is good for. They'll tell you when someone's good. They'll tell you when someone is bad. They'll give you a recommendation on who they feel like you should go to. And so it's so important. Ask questions. Don't be afraid to ask questions and to seek clarification. Get clarification about something when it comes to your health. If you have to ask 1,000,001 questions, make sure you do that. Your treatment options. If they give you a treatment that you don't necessarily agree with or understand, or you don't feel like that's right for you, what are the other options? Sometimes that is the only option. Well, I'll take that back. There's not really only one option. There's usually different options. You just have to come to something where both the patient and the provider agrees. So understanding your healthcare plan and feeling informed and in the know about what's helping you will help alleviate fears and make you feel empowered to make an informed decision when it comes to your healthcare. You can't truly make an informed decision if you don't know what's going on with you, if you don't understand the disease process that you have been diagnosed with. And advocate for yourself. Be an active participant in your healthcare. Voice your concerns, your preferences. And I said all of these before. What are your goals? Make sure your healthcare provider knows what your goals are. Be assertive. Sometimes you got to be a little aggressive when it comes to advocating for care and support of you, your family member, your children, what have you. Because as minorities, many times there have been several instances where our concerns have been minimized and there have been not so good outcomes because of that. And practice safe care, prioritizing your health, making sure that you're good all around, holistically, every part of you, spirit, soul, mind, body, that every area of your life you are doing well in there. Because I mentioned before, one area out of line or not up to par will impact the entire body. And know your rights as a patient. Know your rights as a patient. Informed consent, confidentiality, respectful when it comes to treatment. Know your rights. Knowing your rights can empower you, one, as you begin to advocate for yourself. And then challenge the stigma and discrimination. Speak out against it. Make sure that others know, like if you're brave enough, share your story, because you sharing your story can help someone else feel comfortable sharing and talking about what's going on with them. There's many steps that we can take as patients. There's many steps that we can take as healthcare providers. There's many steps that we can take as minority patients to overcome fear, the stigma, the increased incidence in a disease process or what have you. Talk about it. If you see something, say something. You feel something off, say something. Make sure you are surrounded by a good healthcare team. Make sure you're getting the preventative screenings that you need. Make sure you're taking care of yourself. If you have children, if you have a significant other, you have a partner, you have family, there's other people who are counting on you and who need you to show up, but you can't show up if you're not your whole self, because you're dealing with health conditions or diseases or whatever it may be. Take care of yourself. Seeking healthcare should not be scary or delayed or dismissed because of fear. And I understand there are some things that generations back led up to the fear that many of us, not even generations, yesterday, last week, 2 weeks ago, a month ago, that led up to us having fears and creating those barriers when it comes to healthcare, seeking healthcare in the minority community. I want to say, find you a healthcare provider who you can trust, someone who you can sit down with and talk to. I've fired healthcare providers before because I no longer trusted them. I loved them. They were amazing. They took great care of me until they didn't. And so when you come to see me and other healthcare providers, you're paying for our service. And you should be able to take away from that visit, each and every visit, what it is that you came for, and that you received good care, competent care, and that you were a part of that healthcare decision-making process when it comes to treatment, medications, what have you. I had a situation today just for myself, and then we're going to close. I went to see my provider for a healthcare issue that I'm dealing with. And there was a new provider who came in to see me who works in the office. And yeah, I had to say, no, I'm not doing that. We talked about that with the other provider. And yeah, did you read the notes? So we had to have a frank conversation about that. But I felt comfortable speaking up for myself because I've done the research, I've done the digging on my condition and what it is that I need to do as a patient. And in all honesty, I haven't been consistent with my treatment plan. So I need to get back on board to make sure that everything lines up and the numbers begin to, go where they need to go and do what it needs to do. And so we have to be honest with ourselves and we have to do our part. This has been, and this, I'm very passionate about this, and I hope you guys hear that and that you feel that coming from me, because I've seen too much in the healthcare community and I know too much, and I know people who have dealt with certain things, and a lot of it could have been prevented if we had just got the screenings that we needed. We just got the tests that we needed. So don't allow fear to keep you from seeking health care. Don't allow fear to cause you your life or permanent disability or a lifetime of grief because you have to deal with a certain condition that could have been prevented. So I'm going to get off my soapbox. I'm a little over. I apologize for that. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. We're located at 452 Osceola Street, Suite 106, Altamont Springs, Florida. Our website is wellslegacyhealth.com. You can find us on Facebook. You can find us on Instagram, Twitter, IG, TikTok, YouTube. We're pretty much everywhere. If you need a healthcare provider, you don't have one, reach out to us. If we're not a good fit, I can refer you to someone else. But the goal is to make sure that you're getting great care from an amazing healthcare provider that you trust and know that you are listened to, that you are valued. Until next time, stay safe and be well. This is Dr. Latoya Wells. Have a great evening.